we've continued down the corridors of the maze at this incredible large facility you have here, and we're in the extraction packaging room, and all of a sudden I see a lot more technology and very pharmaceutical-like atmosphere. Tell us what's going on here.
So here's where we are doing a lot of the extraction. We're pulling all the medicine out of the raw product, out of the flower. From there, we can make it available in that raw form, in the extracted form, or we can start infusing it into other forms. Here is where we make the decarboxylated syringes, we fill the pills, fill the vaporization cartridges. What you can see here is an order ready to go out for this week, where all the bottles are packaged up here, lined up, ready to be boxed up, and ultimately shipped out for transport.
And what I noticed that's so interesting in this room is, again, the hands-on manual process that takes place here. These capsules are filled by hand. The syringes are filled by hand. The packaging is all done one at a time, one order at a time by hand. The labels give us, as dispensary pharmacists and patients, the ability to know exactly what's in your medicine, when you purchased it, what's in there, and all the lab assets that it's passed. No different than the traditional pharmaceutical product that you may pick up at your local pharmacy. That's what makes the state of Connecticut's program so different and so much more quality than any other state in the union.
As you can see from your tour here, there's a lot that goes into this final product being made available to the patients. And hopefully seeing what goes on here, there's a more of an appreciation of the level of care that we certainly have taken. All of our employees here are very, very dedicated. They understand that they're making medicine for people, and they take that responsibility very, very seriously.
Again, as a patient, as a dispensary, we can feel confident that the product that we're dispensing to our patients is the highest quality product because of facilities like Theraplant.
It was actually some of the feedback from dispensaries like yourselves. We actually came up with a new labeling system so we can have a much more easily identified what's in it, how much is in it. You know, a lot of the current concerns that physicians have, rightly so, there's no standardization of dosing. So with Connecticut, you have mandatory laboratory testing, so now you know exactly what's in it. And when you start getting into extracted products, now you have an exact measured amount. Now you have a standardization of dosing. Now you know exactly what's in it and exactly how much is in it as well.
Repeatable quality. That's what we're making here in Connecticut. Mr. Ruby, thank you very, very much for this wonderful, wonderful tour.
It's an honor. I'm glad. I thank you for putting in the time and the dedication to helping the patients of Connecticut get safe access to this medicine, and I guess a little bit behind the scenes look at what really goes into it, so they have a little extra comfort, even more comfort, that the medicine that they're getting is the highest quality, is as pure as possible, and is going to help them with whatever condition or disease state that they happen to have.
With CannaEd, we believe in education because we believe an educated patient empowers the patient to make the proper decisions. Thank you.